So in this video, I'm going to share another trick with you where you will never ever forget about pediatric vaccine schedule. That is always confusing you, right? During your Nclex exam, maybe your last question is going to be on vaccination. And they may ask you if the child is 2 month old or 4 month old or 12 to 18 months old or 4 to 6 year old, which vaccination baby is going to receive. Select all that apply. Now you are confused because you don't know the answer, right? But after watching this video, after watching this trick, you will be able to solve, or you will be able to get all of your answer correctly, right? The trick is pretty simple. At the end of the video, we're gonna do some practice question and answer, and you will amazed to see that wow, I gave all the answer correctly, right? After learning this trick. So what is the trick? Pretty simple. So only the 9 vaccination that you need to know. So all are on the bottom alphabetically, as you can see, right? So let's start. So hepatitis A, hepatitis B, DTaP, hemophilia influenza, inactivated polio, and then MMR, pneumococcal, rotavirus, and varicella. That's the only 9 vaccination you need to know for this chart, right? So let's start. So we're gonna start with birth, right? Newborn birth, baby will get only hepatitis B. Simple, right? BBB. Newborn, birth, hepatitis B. That's it. Now we're gonna jump to 2 months. So 2 months you need to know is B, Dr. Hip. Now let's jump to 4 months. I will explain you everything. So 4 months, you just drop B and you just say Dr. Hip, right? 6 months, you bring back B. B means hepatitis B. You bring back B. So B, Dr. Hip again. And then 12 to 18 months, the name is gonna change, Med Hip, right? And then 4 to 6 year old, the name change again as Veridim. That's the only trick you need to know. Now whatever the 9 vaccination on the bottom, you just have to fill up on the top. So let's start on 2 months, right? So B, Dr. Hip, what is that meaning? You tell me. B means hepatitis B, right? D for DTaP, R means rotavirus, H for hemophilia influenza, I for inactivated polio, and P for pneumococcal, right? Simple. Let's jump to number 4 months old. So 4 months we drop the B, hepatitis B, right? Only same thing as 2 months old. Dr. Hip, same thing. All vaccinations same, right? And 6 month you bring back hepatitis B. And at the bottom we also gonna add flu vaccine. So 6 month baby start receiving flu vaccine. Same thing. B, Dr. Hip, right? Simple, right? And 12 to 18 months, now we're gonna introduce MMR. M for MedHip means MMR. A for again hepatitis A, D for DTaP, H for hemophilia influenza, I for inactivated polio, and P for pneumococcal. Now let's jump to number 4 to 6 year old. So very dim. Very dim, what is that meaning? Can you please explain me? Very means varicella, D for DTaP, I for inactivated polio, and M for MMR. That's it. That's all you need to know for your Nclex. So once I share any question, practice question answer with you, you will see that you're gonna give all the question correctly. So rewrite this notes in your notepad somewhere so you can study later on, right? So let's practice some question and answer, and I hope you will get all of your answer correctly, right? Let's start. So now let's practice 8 questions and you will see that you are going to get all of your answer correctly. So let's open the chart and I hope you learn the technique. So let's start. First question. During a routine pediatric visit, a 2 months old patient will need which of the following vaccination? Select all that apply. So 2 months, remember B, Dr. Hip. So B, Dr. Hip, that is, what would be your answer? So pause the video and give answer. So our correct answer B. Where is B, Dr. Hip? B for, so our correct answer is C. D, DTaP. E for HIV, Haemophilus influenza. G for polio. H, rotavirus. And I, pneumococcal. So all those are correct answer, right? Let's go to number 2. Next question. When should a child receive the first dose of hepatitis B? So when? Newborn, birth, hepatitis B. Remember that. So where is that? At birth. Answer A. Easy, right? Next question. A 12-month-old receive a series of vaccination that include hepatitis A, right? When should the child receive the second dose of this vaccine? So when should the child gonna receive a hepatitis A next? Hmm. So the baby gonna receive at 18 months. Remember MADHIP, MAD, MMR, hepatitis A, D for DTaP, right? So there. So that's why I'm telling you, when you get the board, you write down all these numbers so you won't get confused. Tricky, right? Next question. If a 4-year old is scheduled for routine immunization, as the nurse know, you know the physician will most likely order which vaccination at 4 months. So what we gonna order? Remember very dim. So let's crack. So let's start with very is very for very sailor, right? So G for sure. Very dim. D for DTAP. So option A is correct answer. DI. Is there any I? Yeah. No, it's not I. Very D I is not there. M. Let's see. M is there. M for MMR is there, right? And G for varicella. Very dim. So you got it. So correct answer are A, B, E, G. Very dim. Next question. You're providing a free education clinic to a new mom about immunization. You inform the attendees that MMR rubella vaccine is given when? So it's given at 12 months, right? MADHIP, and then again on very dim. So DIM also referred as MMR, right? So correct answer is 12 months and 4 to 6 year old. So that's the wrap up of our practice question and answer. And I hope before you answer this, you have to have chart front of you in order to crack the answer, right? Otherwise, it's gonna be still confusing you. So rewrite this note one more time and practice one more time to yourself, and you will be able to get most of your answer correctly, right? Good luck.